Guys, you're right. Welcome back to my channel. So this video is about my pre-surgery update. I probably won't do too many of these because they can be a bit lengthy. But this is a very candid sort of communication with you where I'm just talking, no editing, nothing. Um, you might find this difficult to watch, but if you persist, you actually hear what I've got to say. So I'm having my spinal fusion surgery on the 12th of December. Um, that's basically come about by being in severe pain for a long time. So how did it all start? It started when I was around 13, 14 years old, something like that. And what happened was I went to Italy on a school sports tour, and I was involved in a collision which was outside of the field of play, outside of the time of play, and also illegal. We're playing against essentially adults, because the way the Italians made the system, the year groups, they sort of for some reason thought that we were 18-year-olds. But it's obvious when we're there, we're significantly smaller than these people. So, you know, whatever it is, I don't know. So I was about 14, and they were generally about 18 years old, give or take. So yeah, I had a legal tackle. Caused me a lot of pain. Initially, I couldn't walk straight for about 2 weeks. A lot of people didn't notice this. I'm not sure how, but I guess I wasn't very expressive as a child. Because of autism, I don't often talk about my feelings or things. Things don't come out as easily. It's very difficult to communicate at times, especially at that young age when you find social things quite difficult, quite challenging. And the way how children are, I was never really bullied to that sort of extent, but I was always picked on for how I spoke, how I looked, like having goofy teeth. People used to keep reinforcing that, so I had it from my whole childhood, and that's really deterred me from being able to communicate with people properly. So they've actually added to that problem. So I've put a lot of time into making myself better at communicating with people. There's a lot of things people don't know. For example, the amount of times I refilm these videos, I do have to I have to record it so many times. When it's just me talking, you don't realize how many times I actually do that recording. So what you get on the screen, whether you're watching on the YouTube channels, is me representing the best I can possibly do with that time. Don't like to do lots of edits and funny things. It's not me. I'm not a sensationalistic person. If people want to listen, they'll come and they'll be captivated by what I have to say, or my guests have to come say. So that's how I work personally. I doubt that I'll ever change with the target audience I have. People that just want to align physique goals with positive health outcomes, as I always say. So yeah, what happened? What is wrong with my back, and what are they going to do? So my spine is not ideal. I have what's called spondylitic spondylolisthesis, one condition, foraminal narrowing at the L5-S1 level, and something called bilateral pars defect. So spondylitic spondylolisthesis is where your vertebrae pushes forward and essentially shifts out of joint. That then compresses the spinal cord, the nerve bundle, and from there you get varying degrees of pain. The grade of this problem does not necessarily indicate the pain that the person will suffer because of it. I know people that have grade 3, whereas I have grade 1. My pain, in most cases, seems to outweigh a lot of what other people's pain is, in terms of the severity. So what are they going to do? They're going to essentially, no, ignore that. This is a very weird video, but just bear with me. I'm trying to get to the point. So the other thing was bilateral pars defect. So at the bottom of my L5 vertebrae, you have these pedicles, like these stabilizers, essentially, little bone things. I'm missing them on both sides. So my structural integrity is not very good. Means if I was to, play American football, have a some sort of collision, whatever it is, that could lead to very severe consequences. So I do have to sort of tiptoe around things a lot of the time and try and be a bit more careful. The way I live my life is essentially trying to avoid making it worse. And people just see this big mass of a man, I'm not enormous sort of thing, but they see that and they think, God, this guy must be tearing himself down. He's doing it to himself. Really not. It's really not it. I promise you. I sincerely promise you, there's nothing more I could do to reduce the pain I'm in. Yeah. So the other thing is the foraminal narrowing at the L5 level. That's just where I'll explain. The space around it is tighter, so around the spine, so it's compressed. So the pain is always there, just to varying degrees. The more upright I am, the worse it is. Standing, walking isn't too bad up to a point. Sitting is generally always painful to some degree. You'll see in my videos. So when I sit down, I'm doing this a lot. I'm twisting. I'm just trying to sort of take my mind off the pain and try and find a sort of comfy spot. So I do suffer with that a lot, and it does affect me day to day for everything I do at all times to some degree. So yeah, the spinal fusion part of it. So they're gonna essentially put a disc in. Give me a brand new spanking new one sort of thing. They're gonna bolt the vertebrae together and hope that fuses together. Therefore, the spondylolytic spondylolisthesis is then reduced. So my grading would essentially be 0, ideally. Then that will mean that my spine is less compressed in terms of the nerve area. So how will it affect me? It's going to give me a lot of benefits, honestly. If it goes well and I recover properly, it will give me a lot of benefits. I'm so limited in my capacity. What people don't realize is when I film these videos, I lie down afterwards because it's painful being upright, especially for a long period of time. I essentially have to micromanage my life in every single aspect to reduce the pain I'm in. So yeah, I'm hopeful and I'm optimistic. So what we're going to do, yeah, essentially it's rods and bolts going in my spine, bolted together and just fixate it essentially. So my range of movement will be reduced, but that's to be expected. Your body's not as flexible as it should be. Just going through my notes here, what else I want to talk about. So yeah, the better quality of life aspect is going to be huge to me. More life chances and most importantly, less pain. Pain does, I keep saying the pain is tremendous, honestly. The medication one makes me so dizzy. Makes me tired at times and it affects a lot of things I do. So I can't often think the way I want to think or how I used to. I used to be much sharper, but on the medication, I'm not that sharp, to be honest. So yeah, other than that, the cons, it's the bad things. So there'll be restrictions on my future capabilities. So I won't be able to probably deadlift 250 kilos again. Things like that. So I have to work around things a lot more and be meticulous, especially if I want to recover properly. There are risks that I won't mention on this video, but they're very severe. And to be honest, out of sight, out of mind, or if I don't think about it, it's probably not going to happen. There's an element of like willing it into action. So I'm willing that this surgery will help me a lot. Yeah, so that's what I'm looking forward to. So yeah, this is drawn out recovery as well. So we're looking at something like 12 weeks before you get back to normal activities, and that's the minimum. I'm quite young, so I might be lucky there. But yeah, I probably won't get back to the gym for about, I'd say, 4 weeks, and that'll be, even at that point, I'm going to be sat down doing dumbbell curls, probably maybe some leg extensions, little things like the very beginner things. There's not going to be any loading at all in terms of heavy stuff. Very restricted and probably even more controlled than what I'm currently doing, really, in terms of the gym workouts. So yeah, other than that, it could take up to 2 years. I'm hopeful it doesn't. I can live with that. I've been in pain for a long time now. 2 years out to think I can live my life without pain. I'll take it. I would honestly take it. See, in essence, I have a lot to be angry about. Um, what happened was when I got the diagnosis, let's go back to square one. Sorry, this video is all over the place, but it's meant to be very real, so you can get a gist of what I'm saying without all these like flashy edits and things. So I had a appointment when I was about 14 years old, just maybe some point after the surgery. So I complained about back pain. So the medical doctor pulled my top up and turn around. All right, he felt down my back and just went just like that, exactly like that. And he said, "Oh, it looks all fine to me. You should be fine." I went on my way, sort of thing. I thought, all right, maybe it's just a bit hurt, so I need to rest it for a bit. So I did. Nothing changed. The pain was still there. So then I went back again at some point. Same thing. Nothing's wrong with you. Do some light exercises and take it easy in the gym. Okay, I can live with that. Fine. Did that. No relief. Again, all right, we're gonna give you a scan. At that point, I was suffering from hip pain as well. So they give me a scan on my hips. And yeah, what happened there? Yeah, not ideal. So I don't have ideal hip function and joint mobility. I can live with that. It's not that bad. I'd rather not have that pain, but at this level it currently is, isn't too bad. But for the last 2 to 3, maybe even 4 years, the back pain has gone up tremendously. You'll notice when I am making these videos of, you'll see I'm sort of twisting a lot and I'm doing this and that, and I'm just trying to get the pain off. I'm trying to shake it off any way I can. So if it means adjusting my hips a little bit just to even out my weight distribution, that's going to help me a lot. So yeah, it's not that I'm being rude to my guests, as someone once said. I don't know how they came up with that, but yeah, you got to do what you got to do. That's my limitations. These are my capacities, and that's just what I try and do. Yeah, I mean, what happened next? Trying to think. Yeah, so I eventually had the spinal scan thing, roughly about a year ago at this point by the time this video airs. And they said, you have these conditions. You have 2 cracks at the bottom of your spine. Fine. Said you're going to need spinal surgery and he's going to want to fuse it together. And yeah, that was essentially it. So I got referred, did the physio. Physio didn't help me at all. In some cases, it aggravated my joint pain. In that the hip thrust exercise is quite damaging for me. Seems to be the most problematic of all the exercises I do. So there's different elements of my own bodybuilding training where I've had to change it to try and strengthen those target muscles without causing any more damage or pain. So yeah, that scan went by. Then had MRI. I said, all right, you got all this wrong with you. Fine, like the things I outlined earlier. And what happened then? They said, right, what do you think? I said, well, if someone was to say to me, would you want to live the rest of your life as you are now with the pain you're in? I'd choose not to be honest. So this is my only choice. There is no dietary protocol, no tablet I can take that will heal my problem. Not one. I've had a lot of people reach out to me probably over the weeks and months and years sort of thing saying, you need to try this or don't do this or do. I've tried all these things. I find it quite degrading sometimes when you're someone that's trying to be honest with people and help yourself, and they give this unsolicited advice, and it does frustrate me to some extent. I mean, I'm sure they mean it in a good will. They have a good heart sort of thing, but I say to them and they persist and say, no, you need to try it. I'm like, honestly, you wonder me, I'm down. Yeah. So anyway, enough about that. So yeah, I've got quite a lot to be angry about, but if I live with that mentality, it's not going to help me out, not going to help anyone else out, and it's not going to get me anywhere. There's a lot to be angry about here. And that's just the tip of the iceberg, what I've said about this all. So what I say is the only guarantee of failure is if you quit. So I don't have that option. I've got to do the recovery properly. I've got to do whatever physiotherapy activities I'm prescribed to do. I have to take my time and just get on with it, I've grown more patience over the years, so it will become easier as time goes on. A week out, I want to get back to the gym. 2 weeks out, I could pass 3 weeks. So my desire to go to the gym may be limited, but by the time it's 4 weeks later, but it might be that I'm fine. Who knows? You know, it's with me, they said it's very much a who knows kind of thing in terms of recovery length. My surgery time itself could be any length of time, because as you're operating on someone, you have a number of different things that can happen during the procedure. Um, they've got to manage clots, bleeding, you know, all this sort of stuff, your anesthesia, all these things can happen. So you've got to think, you know, how long is a piece of string? You know, that's what I think about. You know, so I've had to develop a lot of patience for this. You know, giving it the length of time that I've been suffering for, and you know, this is the only option I have. You know, people think there is other things. You know, if there was, I would have taken it. Believe me, I really would have done. But this is it. This is my plan. This is what I'm putting into action, and I'm going to put my good will and hope out there to be optimistic and attain a good result from this surgery. Yeah, and on that note as well, I want to say thank you for, you know, following my channel and sending me good wishes. Like, I've had tons of messages. Like, I think there's some still I've not even got back to. It's not because I don't intend to, but you know, like, you're trying to put out all these videos and get ahead. So you know, the post surgery recovery time won't be impactful on the videos I'm able to create. So that's what I'm thinking about here. And I'm still getting people message me saying, you know, can you consult with me now? You know, I need to speak to you. You know, something like, I've got surgery in about what, 5-6 days, or whatever time it comes by when you watch this video. But yeah, I've got to spend time with people and, you know, manage my back office stuff before I really get back to clients. But the people that I'm working with, you know, my current coaching clients, it won't be impacted at all. So there'll be maybe a 1, 2, maybe even 3 day period where I won't be available. But so far they seem to be quite understanding of that. And what I've done is I've actually increased their monthly package by a few days. So it'll be whatever amount of days I'm out of action for. It might be that the next day I'm fine. So, you know, they'll just be given the extra day. I don't expect to be talking much on the surgery day because I'll probably be a bit tired. So yeah, that's that. Just rambling now, but yeah, share this video out. Hopefully it'll give some people some insights into, you know, the surgery of a carnivore autistic bodybuilder. For what it's worth, you know, might be useless to most people, but yeah, at least you guys have an understanding of what it is, what I'm going through, and you know, I can send out my appreciation to you guys for watching these videos. So thanks very much for your time. Please remember to like, comment, and subscribe, and hopefully I'll be able to reply back to them within the next few days. So cheers for that.